Hello, welcome to the first episode, the inaugural episode of Dr Foot TV. Now, if you put somebody as creative as me and you quarantine someone like me and isolate me, which you should be staying at home to save our NHS, but if you put somebody as creative as me at home, I will find creative ways to help people. Therefore, I set up a green screen in the house, and no, this is not my real library. I wish it was. And I decided, what can I do to help as many people as I can? Let's start up a TV channel. So, you can find information about this channel below. I've also created a new YouTube live stream, which I'm going to be putting all sorts of videos up and sorts of tips up. But in this TV show, I'm going to be talking about running injuries and sporting injuries. If you are anything like me, you have not done running for a very long time. Now, I love going to the gym, which I can't go at the moment. I love doing weight training, and my form of cardio tends to be HIIT training with kettlebells. Because I don't have any equipment, I've started running after many, many years. I have got aches and pains in places where I never thought I'd ever get aches and pains. So, if you are like me, contact me using the channels below, and I will send you loads of ebooks. I've got ebooks on how to stretch properly, how to strengthen properly, couch to 5k, 5k to 10k, 10k to a marathon, or running programs, nutrition. I will send you all these ebooks free of charge because I want to help as many people as I can. But I am going to be making a series of videos regarding different sporting injuries. For the first 5 episodes, I'm going to focus on running injuries, and I'm going to talk about 5 of the most common running injuries that you might be getting because you've just started running after a very long time. I'm going to talk about patellofemoral joint pain, which is runner's knee, iliotibial band syndrome, which is pain and discomfort along the outside of the thigh and the knee, mediotibial stress syndrome, also known as shin splints. And if you've watched any of my other videos, you will know how much I hate that word, shin splints, Achilles tendinopathy, and plantar heel pain. So, let's start off with the first episode. Let's start off with the first episode. Now, I'm going to be talking about COVID-19 a bit later on, but let's first talk about patellofemoral joint pain. This is pain in and around the patella, which is your kneecap. It's a diffused kind of pain. It can be made worse while running. If you're walking up and down the steps, it can be quite agitated. If you're doing a squat, actually, so if you're doing a lot of squatting motions, that would make this pain a lot more painful. This particular condition. Now, there are many different studies and a lot of research that has been done about patellofemoral joint pain. There are many different causes that have been stated, including biomechanical causes, but I think in this current climate, probably the most common cause would be that you have increased your load too quickly. Now, you have not been running very much, and then you have suddenly started to run or do an activity. Your muscles, tissues, joints, all operate within a zone of optimal stress. So they're used to being strained at a certain level. When you suddenly peak and you're suddenly doing a lot more activity, you can develop this type of discomfort and pain. So first thing is, don't stop running or stop doing the activity that you're doing, but dial it back a bit. So go out, go for a walk, and then start running a little bit, and then slowly start increasing again. One of the other causes can be overstriding while you're running. I'm going to do a whole different show on running mechanics, because I do, with my patients in clinic, I do gait retraining, and I'm looking at stride length and stride width and a lot of other things. However, if you have got a watch, a running watch, or any other gadgets that measure your cadence, which is the amount of steps you're taking per minute, it may be an idea to increase that by 5%, or 7.5% is a really sweet number. 10% tends to be quite effective but hard to maintain. But if you don't worry. But if you do have a running gadget and you're getting patellofemoral joint pain, message me below and I will tell you how to use certain tools that can help you to increase your cadence, and that may help you to stop overstriding, which I'll put up a picture to show you what overstriding is. Now, research has suggested that if we strengthen your muscles around your hip, muscles around the knee, especially the vastus medius oblique, quad muscles, and your muscles in your calves, we can help to take the strain off your patella and ease your discomfort. So the strength and conditioning is a vital part of your treatment. There has been some studies that have said that orthotics can be very effective in the treatment of patellofemoral joint pain. If you want to know more about orthotics, message me using the channels below, and I will send you some links to various different insoles that you can purchase to put in your running trainers when you are running, that do not cost an arm and a leg, especially because a lot of you are not working at the moment, and that can be used in addition to strength and conditioning program to help you recover from patellofemoral joint pain. But orthotics, insoles, are not a magic bullet. In fact, they're very rarely a magic bullet ever. They need to be combined with strength and conditioning and flexibility. But if you are interested, let me know. Now, I am going to go through a full rehab program. Rather than me put videos up, I'm actually going to make a video and show you the strength and conditioning programs that I think you can do at home or in a park to try and alleviate your discomfort around your patella. And I shall speak to you soon. Hello, I am in my local park going for my morning run. I wanted to show you an exercise that I would recommend for patellofemoral joint pain. Now, this is a muscle that will activate your glute max, and it actually activates it quite a bit. If you can find a park bench, or if you've got a sofa at home, put one foot on the sofa and get quite close to it. You don't want to be too far away from it, and you want to step up, putting all the force on the leg that is on the bench or the sofa. But what you don't want to do is use the heel of your back foot to propel yourself up. So you want to put your weight on there and you want to come up in a vertical line as such, like that. Now, two of the mistakes I see people doing for this is, one, they're too far away. Two, they are not coming in a vertical line too much. They're going forward and they're losing their balance, or they're using too much momentum. So the idea is to keep still, put all your weight through this leg, come up and down. That will help your patellofemoral joint pain. The second exercise I'm going to show you is called the split squat. So what I want you to do is have both feet shoulder width apart, both feet facing completely straight. Okay? Keep your core and your spine tight and straight. I want you to come down slowly, come back up again, put both feet together and do a side raise. So let's show that again. Both feet shoulder width apart, straight down, feet together, side raise. That will help. Hi, I hope you enjoyed that video that I just made with me showing you all the exercises. If you do those exercises and you possibly combine that with orthotics, your discomfort around your knee will get less. But remember what I said to you about the amount of load and running you're doing, and if you're not used to it, dial it back and then slowly come back into it. There are many other treatments that can be done for patellofemoral joint pain, but right now just work on strength and conditioning, and that will help. Now, we are in a strange time, aren't we? A global pandemic in our lifetimes, with the whole world going on to lockdown. very scary. People are very anxious, and I completely understand why. If you are like me, and if you are a person of faith, then you ultimately believe that everything is a test from God. And it's about doing our best during these times. I hope you are taking care of your elders. Hope you're taking care of your neighbours. Hope you are doing what you can for your National Health Service, for your hospitals. I will be volunteering at the local Birmingham Nightingale Hospital at the NEC, if they will have me, and I'll do whatever that they require. So until then, I will be making weekly episodes, and I shall speak to you soon. Take care of yourselves. Stay healthy. Stay happy. Stay blessed. Bye.